Today I wanted to chat with you about something incredibly difficult and intimate. I've gone through multiple iterations of what I wanted to say, and as you know, I usually release a video once a week, but this video has been in the making for well over a month. So I decided to interview a few folks who have been grossly abused on the job, and I want to use my platform to give them a voice to all those who have sacrificed so much for their profession while trying my best not to give any reason to my own employer to be retaliated against. So before we begin, let's start with a disclaimer. This video contains anonymous opinions and scenarios curated based on interviews with multiple employees at various outside institutions, and these views are not necessarily representative of those of any of my current or past employers. My views towards my own employers have been actively excluded from today's conversation. Patient cases are not based on specific persons and are purely hypothetical. There is no violation of HIPAA. Any similarities to real life events and people may be purely coincidental. Viewer discretion is advised. So with that said, let's start to explore the affront on mental health that your job may be causing and the toll that working in the high stress environment of customer service with a special focus on healthcare is taking on our labor force. We're going to talk about burnout and why so many of you incredible folks in the medical field, retail, hospitality, food and beverage, and tech industry, and really any industry for that matter, are fed up, frustrated, and won't take any more crap. And then we will discuss what you can do personally to focus on your mental health, specifically from a money standpoint. So 4 million people quit their jobs in August of 2021, with an additional 4.4 million people quitting in September 2021. That's a total of 6% of the entire grassroots tax-paying American workforce in just 2 months. So what is going on? Before we go into much more depth, let's talk about why folks go into medicine or any other customer service field for that matter. Most of us growing up want to find a career where we can make a real difference in the world. And definitely in medicine, there's almost this transcendental calling where you want to be able to serve your fellow human being and connect with them on a deeper level, where you want to be part of a movement greater than yourself. You believe that your job is more than just your salary, and if you want to become a doctor, you better have the mental fortitude to withstand some pretty harsh conditions and be ready to give up quite a bit of your time and freedom starting from childhood. Stick with me here these next few minutes. I promise you it will give you more meaning to what is going on in terms of burnout in the medical field and probably your field too. To give folks an idea of what it's like to train to be a doctor, beginning from elementary school, you were almost always studying and doing your homework while your friends played. In high school, you were getting straight A's in your AP classes and studying your butt off for the SAT while your friends hung out. You were cooped up for hours on end in a lecture hall or library in college, day, night, struggling to learn and memorize and conceptualize, leaving very little time to party. I remember personally concurrently working as an EMT in college, making $12 an hour during the times when I was not in class or studying to gain experience and to help alleviate the student loan burden. Then there was dealing with the massive uncertainty of whether your entire lifetime of studying and hard work would even amount to anything. As you study for the MCAT, scramble for recommendation letters, and apply to various medical schools, anxiously waiting months to see if you would even get in. For those who get in, there's some sense of relief for a little while. I remember on the first day of medical school, a dean gave a speech and asked each of us to look and feel the seat we were sitting on. He said 24 other people wanted to sit in that seat, but instead we were the ones that had the privilege to sit there. Medical school admissions are tough because they try their best to select people that would be able to succeed in this intellectually, physically, mentally, and emotionally demanding field. Then the dean shows us this photo of a cat stuck inside a jar, and he asks, "So you worked hard to get to where you are now. Are you sure that's where you want to be?" In medical school, you meet some of the greatest, most inspiring humanitarians you'll ever come across in your entire life. These are super hardworking, genuinely passionate doctors who find it absolutely critical to focus on a patient's mental health and physical health. We all know I had this new mindset when we were studying, that if we didn't study hard enough, people could die as a result of our actions. We flog the crap out of our brains and our bodies for 12 hours straight, 5 to 6 nights a week, days, weekends, holidays, working, studying to learn as much as possible. There was a brand new language that we learned called medicine. You use words that most people have never even heard of, and then you formulated all these words into concepts and you applied this knowledge to real life people who usually don't fit into the textbook examples. You learn how to evaluate data and sources and quickly realize you can't just Google the answer to figure out what's going on with complex patients. These are folks who would come home at 8 p.m., dead tired, beaten, destroyed from a shift at the hospital, only to study for a few more hours before heading to bed, and then waking up at 4:45 in the morning every day to do it all over again. Many student doctors won't talk about their struggles with major depression because they don't want it showing up somehow on the record when it comes to applying for jobs in the future. Resident doctors give up their fun, prime income earning years in their 20s, working 80 hours a week for 10 to 15 bucks an hour in the hospital, missing cherished moments with their young babies or even postponing babies altogether, spending time away from aging parents and grandparents, missing July 4th barbecues, Thanksgivings, Christmases, New Year's parties, weddings, and sleep that they'll never even get back for years on end because they dedicated themselves to the cause. The cause to alleviate the pain of others, the cause of serving your fellow human. While your college roommate became an engineer making 6 figures at age 22, reaching total gross earnings of well over $1 million by the time you finish residency 7 to 10 years later, you would have a negative 6-figure net worth to your name in your late 20s or early 30s with $200,000 worth of student loan debt. Nothing against engineers and all, they definitely deserve the money for the value that they bring to society, but I'm just letting you know the financial challenges that these student doctors are up against. You have great intentions and want to be the change that you want to see in the world. You spend hours memorizing the medications of each of the 4 generations of cephalosporins and nerves and cords and roots of the brachial plexus. You learn to recognize aortic insufficiency as a decrescendo diastolic murmur auscultated at the left sternal border. You recited the layers of the abdomen from skin to viscera. You've lent a listening ear and open arms to a patient when you broke the news that the hemiparalysis from their stroke is likely to be permanent. You empathize with the middle-aged woman with severe undiagnosed depression that gets expressed as insomnia or headache, who is caught in between taking care of her own mother with Alzheimer's and her grandchildren while her own kids went to work, all the while neglecting her own mental and physical health. You want to heal both emotional and physical wounds. You want to listen, you want to care, you want to connect. You go into your field, any field really, whether that's medicine or tech or hospitality or retail or food and beverage, because you love working with people and developing the relationships and connecting on a deeper level. But then comes the questioning of your intentions and your knowledge, and the unreasonable demands, and the yelling, and then the emotional and psychological assault, and God forbid, sometimes even the physical assault. You see, any customer service representative really serves at least 3 masters, if not 4. The customer, the company, themselves, and their family. There's this term that gets used all the time, patient-centered or customer service. But how can you be client-centered if you don't take care of the people who are taking care of your customers? How about we start talking about centering our care on the well-being of the healthcare provider first? How about we be nurse-centered, hospital staff-centered, employee-centered? Why? Because by first focusing on the wellness of the person providing the service, that is the basis of being customer or patient-centered. The doctors who work for various institutions that I interview for this video have unanimously asked me to have them remain anonymous due to fear of retaliation when they still have 6-figure student loan debt to repay or a family to feed. They have said that they have been told by their institutions that they cannot fire a patient for abusive behavior unless the healthcare provider is physically or sexually assaulted. These healthcare providers have told me that they have had patients threaten to attack them if they ever saw the provider on the streets. These doctors and nurses have had to seek mental health services for themselves, struggling on antidepressants because of emotional and mental traumas that they have experienced. They have had their administrators tell them to just give the patients whatever they want, even if it's medically unjustified or even potentially medically harmful, because patient satisfaction scores are important. One doctor told me that there was a patient that asked her directly to kick out other patients in the schedule to be moved to other days so that they themselves can be seen ASAP. Some patients will come in showing you their research from absolutely incredible sources, demanding that you give them what they need. Then there's this sheer insane workload, the endless paperwork, all the clicks that you have to do in the electronic medical record just to get anything done, all these metrics you have to make, the insane time constraints, you forgo lunch just to stay afloat. When these providers went to seek help, they were asked instead what they could have done to make the situation better. Or worse, you were told to attend a wellness seminar or that you should do yoga or eat granola as if it was you that the one that won out against 24 other highly qualified, mentally strong people to get that seat in medical school. That was the one that was lacking resilience needed to do this insanely stressful job. And I know there are customer service providers in all fields that have been abused. Look at the unfriendly skies, look at retail employees or restaurant staff that have been spit on or yelled at or physically or psychologically abused. Who can blame anyone for calling it quits these days if it means our lives are literally on the line? Are we surprised, America, why people are quitting in droves? Life is short. We could die tomorrow or even worse, become gravely disabled. That has become abundantly clear in this past year. So would you blame someone for wanting to seek out an environment that nurtures them and inspires them to grow and succeed, that allows them to pursue the one thing that lets them make an impact on the world? If you're an administrator or manager and you are seeing your staff quitting, my question to you is this. If you want to focus on customers or patients, is an employees first approach totally unreasonable? I personally love the business strategy of Southwest Airlines, where the mantra is employees first, customers second, and shareholders third. You know why this works? You can teach an employee all the customer service strategies in the world, but if your employee isn't happy, the level of customer service that they provide will definitely suffer. Most places still advertise that they put the customer first because it's the customer who pays. But how do you plan to serve your customers when the workforce is leaving? How do you plan to provide a great customer experience when your workers are suffering? If the mission truly is customer or patient centeredness, then treating the staff first and best should be of the highest importance. When employees feel valued and cared for, it will easily reflect in their work with their customers. Use the carrot, not the stick. Managers and clients, ask yourselves this. Are you treating the service workers like the heroes that they are being called, as that sign says outside? Are you paying them enough? So here's part of the solution. We must not continue to endorse abusive behavior either actively or passively. We must stand up and support our staff, especially the ones that have been hurt. We must find a way to alleviate the sheer volume of the workload and allot appropriate time to do the work that the institution and the individual both find to be important, and stop with all the busy work that doesn't provide any value. We must stop wasting our resources on energy vampires in our work that do not improve outcomes, but just drain our mental health. There are big changes that have to happen in any customer service field, and especially medicine in general. Otherwise, attrition will continue. In medicine, you already have some of the strongest, smartest, dedicated, hardworking, idealistic people that have ever entered this field. Do not crush them. When you see this huge space of fire-interested wearers of scrubs and white coats, you have got to be wondering, what is going on in this job environment that is driving so many of you have fought so hard to become doctors, dentists, nurses, to be so actively interested in becoming financially independent? Are you merely greedy, or are you desperate for change? Are you being irresponsible for wanting to leave this crucial role we have in society? Or is the field being irresponsible to you as a healthcare provider by not providing you with the appropriate tools and time and support to help the patients that need you the most? The field of healthcare, and any customer service industry for that matter, is in a right position right now to create the change that is so desperately needed to prevent further trauma directed towards those who want to serve and give. So that's the situation. What can you do about it? As employees, you'll have to communicate your needs clearly. You'll have to be honest with yourself, and you will need to have honest, open conversations with your manager. You'll give feedback and suggestions for change. You will request fair compensation for your time and for the value that you provide. If your employer is not being respectful of you and is not willing to change, it is time to leave. There are job openings aplenty. For those of you who are able and willing, you will build up your finances, save and invest so that you will feel empowered to say what you want to say to your employer to improve the system. You see, most folks who are interested in the FIRE movement are abundantly aware that it may very well be unsustainable to work for decades in the current conditions. If you're looking for a way out and hoping for institutional change that may or may not come, it's not a great strategy. FIRE is a way for you to put the control back in your hands so that you're not dependent on a paycheck. FIRE is power. So we're all going to have to each do our parts, from the patients to the administrators to the workers, to make it actually more sustainable for workers to be able to serve clients or patients that in a way that they deserve to be treated with the utmost respect and care. We're going to be nice humans. We're going to support each other. We're going to listen. We're going to voice our concerns. We're going to make work more sustainable, and we will get better working conditions. We'll have a realistic expectation of ourselves and of others. We will have a manageable workload, and we're going to eliminate energy wasting processes. Or we're going to reach FIRE. I'm an optimist and a strategist. I know it's going to work out in the end, one way or another. So if what I said resonated with you or shook you in some sort of way, please share this video with your friends, your coworkers, your colleagues, your family. Somehow slip it so that your administrators and policymakers will see it. We need to get the word out that employees deserve to be treated better. Otherwise, you will truly have a mental health and economic crisis on your hands if things don't turn around right now.